Hello, my name's Adrian Richards. I'm a plastic surgeon and the surgical director of Aurora Clinics, which is based here in the United Kingdom. Now, I'm going to be talking a little bit about breast reconstruction, what it is, and a little bit generally about the options available for you. Now, breast reconstruction is quite a specialised type of plastic surgery, and although I've trained in the technique, I don't perform breast reconstructions at the moment, but I do know quite a lot about it, so I'm going to be giving you some of the options in these videos. We do have a number of plastic surgeons in Aurora Clinics who do specialise in breast reconstruction, and if you do decide to make a consultation, it will probably be with one of them rather than myself. But I can give you a little bit of background about what's involved in the procedure. Now, who would benefit from a breast reconstruction? Well, breast reconstruction is essentially surgery after surgery to the breast, normally for breast cancers, can rarely be for conditions that aren't cancerous, which change the shape of the breast. So, burns or infections, things like that, which can change the appearance of the breast. And breast reconstruction really aims at making a more normal appearance to the breast. And as I mentioned, it's normally after cancer operations. So what type of operations can you have for breast cancer? Well, you can have a lumpectomy, which is just really removal of an area around the breast lump. You can have a wide local excision, which is removal of the lesion, plus a bit more of breast tissue. You can have what's called a quadrantectomy, which is a removal of a quadrant of the breast, and you can have a total mastectomy. And the mastectomy may involve removing the nipple and breast skin. So there's lots of different types of operations for breast cancer, and surgeons nowadays are tending to be a bit more conservative with the type of operations they perform. Essentially, there are different types of breast reconstruction. So let's just run through those a little bit. You can have an immediate reconstruction, which is reconstruction at the time of your primary surgery. So the breast cancer is taken away and the breast is reconstructed. So that's primary reconstruction. Or you can have reconstruction at a later date. So the breast tumour is treated, you wait for a few months, everything's settled down, and then you have reconstruction. So we can either have immediate reconstructions, primary reconstructions, or delayed reconstructions. So that's all just a matter of the timing, whether you have one operation or two operations. The other main definition is what type of reconstruction you have. There's two main groups here. There's implant reconstruction and there's reconstruction with your own tissue. And in fact, there is a group slightly in the middle where you have a bit of reconstruction with your own tissue and also a bit of reconstruction with an implant, which I'll talk about a little bit. Okay, so implant reconstruction is basically using a breast implant or a tissue expander, which is just an inflatable implant, to replace the breast tissue you have lost. A tissue reconstruction is using tissue from your own body, either from your tummy normally, or your back, to restore the volume. So basically you're pinching a bit of tissue from another part of the body to restore volume to your bust. And I'll talk a little bit about each of those procedures in the subsequent videos. So thanks for watching this video, and I hope you'll be able to watch the subsequent video in our series on breast reconstruction.